Let's Queer Up LGBTQ plus health. Nearly 1/3 of all LGBTQ plus report being treated unfairly by healthcare providers. A new Kaiser Family Foundation report reveals that LGBTQ plus adults are twice as likely to experience negative healthcare interactions as compared to their non-LGBTQ plus counterparts. The report found that 1/3 of all LGBTQ plus adults experienced unfair or disrespectful treatment or had at least one negative interaction with a healthcare provider, compared to 15% of non-LGBTQ plus adults. Among those who reported negative experiences, 61% of LGBTQ plus adults said a provider made assumptions about them without asking. These adults stated that the healthcare provider suggested they were to blame for a health issue, ignored a direct request or question, or refused to prescribe necessary pain medication. In contrast, 31% of non-LGBTQ plus adults reported similar experiences. The consequences of these interactions are significant. 24% of LGBTQ plus adults reported worsening health due to negative experiences, and 39% are now less likely to even seek health care. Furthermore, 36% of LGBTQ plus respondents changed providers because of disrespectful treatment, compared to just 16% of non-LGBTQ plus adults. LGBTQ plus individuals with lower income, women, and young adults aged 18 through 29 were most likely to report negative experiences. The report also highlighted racial disparities, with Black and Hispanic LGBTQ plus adults more likely to face unfair treatment due to their racial or ethnic background. Lindsey Dawson, Director of LGBTQ plus health policies at KFF, emphasized the need for targeted policies to address disparities and promote health equity. The Kaiser Family Foundation survey demonstrates the desperate and vital needs that the LGBTQ plus community face in receiving compassionate and inclusive health care. Well, I will say that as working for Holy Cross Health, I am proud to represent them, and I can definitely speak on this topic because, again, as I shared earlier, having experienced, a very dire health diagnosis, it was a very interesting process to walk through. And I've had people and providers who, made assumptions because of my size, because of my racial background. But at this age, as I tell people all the time, I come with disclaimers and I give them freely. This is a partnership in healthcare. I respect every provider for their years of knowledge and learning, but we have to work together because I understand this 50 plus body. And so I, as I've done things in the community and I've had men's groups, and I try to talk to my patients and tell them, build a partnership, with your provider, and go in with notes and ask questions. And it is okay to stop a provider and to say, okay, you know what, I have a question. And now the great thing is, like at Holy Cross, we have My Chart. And you're able to put those questions in before you even see the provider, and the MA can look at them and make sure they're addressed, and then you can follow up with the actual provider when you're seeing them. So we have to be advocates for our own health. And I remember one particular thing, and then I'll be quiet. I met this doctor for the first time, and as soon as she saw me, within 30 seconds, oh, you're a perfect candidate for gastric bypass. And the word that came to my mind, not my mouth, I was like, no, you don't even know me, and you're already making, this assumption. And, granted, I knew that I was overweight, but, just don't tell me first thing, not even hello, really. It's like, oh, I can get you. And I mean, just immediately went into it, and I had to slow her down. But I fortunately learned from my mother, I will fire a provider in a heartbeat and won't think anything about it. Because if we're not cooperating together in regards to my health, you're not of use to me.
That is shockingly offensive. Do you think it would make a difference if there were more LGBTQ plus doctors in healthcare? Do you think it sounds like these are mostly non-queer doctors. Do you think it would make a difference?
I've had an experience where I would say maybe 50% of my providers wound up being LGBTQ plus. And in some ways, yes, it does make a difference. I think definitely when it comes to sexual health, being able to be free to talk about your provider, you know, we are fortunate, as I know, I'm not trying to plug anybody, but there's a few people within our Wilton Manors office that each of those providers, there's 3 of them, will give you competent health care. And that makes a very big difference, that you can go in and you can talk about, hey, I had this type of sexual interaction and I'm feeling uncomfortable, and you don't have to worry about the doctor like, oh my God, you know. So did I just do that on TV? Yes, I did. But it does make a difference, in my opinion.
Yeah, I'm just curious if in medical school there is some courses that they must take about how to deal with a wide spectrum of patients that will come through your door, of different ethnicities, different sexualities. I just a curiosity.
There are actually, and you know, you can kind of drill down even more and get some special accreditation. And you know, that's the one thing I can say about all of our providers in our Wilton Manors clinic. You know, they're on their little slicks, they have Safe Zone, so they've done some additional training, you know, to actually be able to communicate and properly care for members of the LGBTQ plus
so
community.
Important, like so important, especially with our trans friends and family. Like, I'm sure the doctors are just like, I don't even know what to do here. So I think it's just super important to have.
You know, KFF has, they were appointed by the they did their HEI, and they are a leader. So they got an extremely high score. So when it comes to, you know, health equity index, they are one of the leaders, you know, in the country, which is amazing to see. So it shows that they've done their research, and obviously their policies and their procedures are in place, which is critical. I think it's also important when we have medical clinics and medical providers, and when they're hiring staff, these clinics know whether they have a large LGBTQ population or not, and they need to be letting those nurses and
training,
MAs and people that are coming in like, how are you working with an LGBTQ community? Because if they're not familiar with that, it could be a learning curve, and that's how we start keeping that from happening, I think.
Yeah, and thank you, Michael, for sharing that. So anyone that's looking at this can know that there's great resources right here in Wilton Manors and across the country.
Totally. And one thing that I'll just end with too is that regardless of our skin color, regardless of our shape or our size, when you peel all of that back, we're still human. We all still bleed. We all, you know, have the same vital organs. And so if we could learn to see one another as human and stop looking at what this outer shell is, or how this outer shell express their sexual love and desire, and just keep in mind that we are human beings that deserve fair and equitable treatment
and respect.
And respect,
Absolutely.
yes.
And there's so much more than just a physician too. You know, when you talk about your medical providers
Yeah,
in
the
the
partnership,
community,
like you
it
said earlier.
is.
It's like you have to be able to have this ongoing contact with your provider, just so they know what you're doing and what your progress is and what your goals are.
Exactly.